Hello, good afternoon, everyone. Thank you for joining us for our provider and case management webinar. Today's January 27th, and hopefully you are staying warm and safe in this extremely cold winter weather we have been having. So I'm going to go ahead and jump right in. My name is Heather Dane, and I'm the Chief Program Officer with the Bureau of Disability Services, and I'm going to be presenting the information today. So next slide, please. So before we get started, we always like to share how to use live captions. Next slide, please. And so to turn on your live captions and subtitles, select Captions and Subtitles On in your video controls. And to change the caption language, you have to select Settings and then Captions and Subtitles and choose the language that you would like to use. So as always, our agenda will be to provide some updates for all providers. We'll also provide some updates that are specific to providers and case managers for health and wellness and TBI waivers, but then we'll also do some updates specific to CIH and FS waiver case managers and providers. We have a couple of trending questions we want to share. And then, as always, we solicit and welcome any webinar topics or ideas that you have. So let's go ahead and jump right into all waivers, provider and case manager updates. So the first update we want to share is around the extraordinary care allowance. So on January 6th, the Indiana Health Coverage Program's bulletin was issued. It's bulletin 20263 from the Indiana Family and Social Services Administration that announced our implementation of the extraordinary care allowance. This is for individuals receiving attendant care through the health and wellness pathways for aging waivers, and also for those individuals who are receiving participant assistance and care, also known as PAC, through the family support waiver. So this allowance is outlined in detail in the approved HCBS Medicaid waiver amendments, which were effective December 31st, 2025. So we wanted to go ahead and give you some information around that. And so when we talk about what does extraordinary care mean, it means care provided by the parent of a minor child or by a spouse, which is also known as legally responsible individuals or LRIs, that the individual receiving care is unable to perform that care independently to meet his or her intensive nursing care needs under the supervision of an interdisciplinary team. So the care that must be provided under the supervision of an interdisciplinary team and must exceed the range of activities that an LRI, which is the parent of a minor child or spouse, would ordinarily perform in the household on behalf of a person the same age without a disability or chronic illness. Please keep in mind, this extraordinary care refers to characteristics of the individual in waiver services, not the care that will be provided through attendant care or PAC. So no matter what, all paid staff must adhere to the service definition and allowable activities when providing attendant care or PAC. So what extraordinary care does is it provides the allowance for that LRI to be the paid caregiver in these certain circumstances. So one, the individual must meet the definition of extraordinary care. It must be documented in the person-centered plan. It must be approved by the individual support team and the FSSA extraordinary care and be approved by the individual support team and FSSA. So extraordinary care is defined as those individuals who have the following needs. One is tracheostomy care or continuous ventilator management or total parenteral nutrition, also known as TPN. The individual may also have other comparable nursing services, which include a combination of at least two of the following. So this would be seizures that are frequent, severe, or medically complex and require monitoring of the individual following seizures and monitoring for needed post-seizure assistance. Or IV medication administration that requires close monitoring and observation, or complex wound care that is ongoing in nature and requires regular positioning, monitoring for signs of infection, protection of wound sites during activities of daily living, or non-continuous ventilator management, which may require close monitoring for signs of distress or breathing difficulties. So keep in mind, you have to have at least two of those to qualify under the other medical conditions. Requests for review of extraordinary care must be submitted to FSSA by the waiver case manager or the managed care service coordinator. So those requests are reviewed and determined by FSSA, and documentation from a physician involved in the individual's care confirming the skilled need must accompany the request using the state form 450B. So that 450B from the physician must include documentation of either the tracheostomy care, the continuous ventilator management, TPN, or at least two of the four of these conditions listed on your screen. So let's jump into the HCBS settings rule, which is one of the hallmarks of waiver services. The HCBS final rule has information and includes additional requirements around lease agreements. And these are for provider-owned or controlled settings. And that states that individuals who live in a provider-owned or controlled setting must have a lease or other legally enforceable agreement. So please keep in mind, if a provider holds a lease with the property owner or landlord and subleases with the individual, then a copy of the original lease must be provided that demonstrates the allowance of the sublease, as well as written consent from the property owner or landlord as applicable. So please make sure that those subleases are have, yes. Please make sure that those subleases sorry about that. I had someone come into my office. Please demonstrate that those subleases have a written consent to do the sublease, or sorry, that the lease has the written consent to do the sublease. Next, we're going to incident reporting. So if there is an incident of alleged, suspected, or actual abuse, neglect, or exploitation on an individual, then the provider must suspend the staff involved in the incident pending provider investigation. So please keep in mind that staff should not work with any individuals until the investigation is complete. So if that staff has been is suspected of or confirmed actual, alleged, suspected, or actual abuse, neglect, or exploitation, they must suspend that staff until pending the provider investigation. If the provider did not know at the time of filing that there was alleged, suspected, or actual abuse, neglect, or exploitation, but the incident is reviewed and coded as such, or new information is provided that may indicate those allegations, then the provider should at that time suspend any involved staff pending an investigation. All right, next slide, please. Wanted to provide you an update on the portal. And so after February 12th, 2026, CAMS is going to be completely retired and no longer accessible. So all remaining functionality and information will be migrated to the BEADS portal. So, we did a waiver consolidation back last year where we brought all the waiver information into the portal, but there was still some functionalities that were existing with non-waiver services and CAMS. So all of those so CAMS is now going to be completely retired, and all of those functionalities are now going to be migrated into the BEADS portal. So please keep in mind that means the portal will be offline for the migration starting the evening of February 13th and will be accessible again on February 17th. So there is also a banner when you get in the portal that provides you with that reminder, but we wanted to make sure, that you were aware as well. And please be sure that you're registered with FSSA Communications for future updates on that transition and training. So any questions that you have related to that, you can contact beads.help@fssa.in.gov. All right, next slide, please. So now let's talk about updates specific to the health and wellness and traumatic brain injury waivers. There was a clarifying bulletin released, and that bulletin is bulletin number 2024134. That really just kind of further clarified and reminding providers of the requirements in Indiana Administrative Code 455 IAC 2-14-1, that those apply to all direct care service providers. This is including structured family care. The IHCP requirements for tuberculosis testing and policy for direct care HCBS provider certification align with the current Centers for Disease Control and Prevention guidance. So for added clarity, structured family caregiving was added to the list of examples of direct care services. Please keep in mind those were just examples, but we have added that as we've gotten a lot of questions, and so it's always been a requirement as structured family caregiving does provide direct care. So to qualify for HCBS certification to provide direct care services, providers must meet the following requirements. It is that a TB test is required for all direct care employees upon hire prior to face-to-face interactions with clients, and the TB test is to be stored in an employee's personnel file. The provider's personnel policy will include that the agency will provide yearly TB education to direct care employees, and that an employee will be required to have an updated TB test upon known TB exposure. So if the TB test is positive, a negative X-ray is required. So if you have any questions related to this bulletin or to the TBS testing requirements, you can submit an inquiry to the OMPP HCBS certification portal. And again, you can refer to bulletin 202-609. Also wanted to point out another bulletin that was released related to previously announced changes to assisted living billing policy. So we have issued a new bulletin regarding changes to the billing policy that was previously announced in Bulletin 202-5173. So we received lots of questions and feedback around that bulletin. And so after consideration of that feedback, FSSA is pausing the implementation of the monthly billing requirements and daily per diem requirements outlined in that 202-5173 bulletin. So until further notice, assisted living providers can continue to bill for assisted living waiver services using either the monthly or daily billing method. We will, as a whole, FSSA as a whole, will work with stakeholders to develop and implement a new billing policy later this year in 2026. So therefore, just as a reminder, assisted living providers can bill monthly or daily for services up to 29 days. So that monthly billing can still be done even when a resident is out of the facility, as long as the resident is present in the facility for a minimum of 15 days per month. Assisted living providers may submit claims for reimbursement only after HCBS waiver services are rendered. Claims for daily billing submitted for future dates of service, so that would be, before the service has been rendered, will be denied. Claims for monthly billing can be submitted after the member has been present in the facility for a minimum of 15 days. So for additional information, you can see the clarification bulletin, which is bulletin 202-5190, which was issued on December 31st, 2025. Wanted to also provide a reminder to all case managers on the health and wellness and TBI and those support teams that case managers must provide the abuse, neglect, and exploitation fact sheet to individuals at their annual meeting and document that this has occurred. Please make sure you're documenting that has occurred. And if you need to find that resource, it's available in the BEADS portal resource page, and it's available in both English and Spanish. In addition, BEADS wants to remind all case managers and their individualized support teams that it is necessary to support individuals who are responsible for self-medication. So this may include, when determined necessary, ensuring the presence of a medication reminder system, ensuring a system to ensure medications are clearly marked, and ensuring that all individuals have the necessary supplies when needed. So please keep in mind, that you should be working with individuals to determine what exactly it is that they need if they are self-medicating, to provide that support, and then put in those supports that are deemed necessary and appropriate. All right, so let's move into updates for the CIH and FS waivers. So as always, we are going to provide our reminder around provider attestations. So please keep in mind that the provider system administrator, must log into the BEADS portal and confirm the provider profile information at least every 90 days. So please keep in mind, doing this attestation is good for your business. It allows for individuals and families to have current and accurate information so that they can make an informed choice of the agency they want to provide their services. If they want to choose you, but your information is not correct on the choice list, then they don't have the proper information to connect to you. Doing these attestations are super simple and easy to do. And it also, not only does this provide a space for you to update your information, but it also allows you to add and remove employees, which protects you as an agency from potential HIPAA violations. So please make sure that you are going in every 90 days and updating your addresses, your emails, your phone numbers, services, counties, and contacts. And that you are changing your portal assignments or adding and removing employees or former employees. If you need information on how to complete the attestation, you can go to the user guide within the portal, which is located in the resource section of the BEADS portal under user guides. Okay, so then as another reminder, the Home and Community Support Professional Registry is live and in effect. So FSSA launched that statewide training curriculum and platform for direct support professionals, and that all HCSPs must be trained prior to providing the applicable service. So this was a January 1 implementation, and so now all providers and HCSPs must be trained prior to providing that service. So this is true for new and current providers. So if you are an organization who employs an HCSP, and have not registered, you need to fill out that administrator survey immediately. And then you need to email the HCSP training at cyrahealth.com and beats.help@fssa.in.gov stating that you have completed the survey. So this will alert the appropriate people and allow our support team to set up your group with the appropriate admin access and share instructions for getting your learners started with the training program. So as a reminder, that HCSP, that direct support professional or home and community support professional, cannot provide the applicable CIH and FS services after January 1, 2026 without successfully completing the training and receiving their certification and appearing on the registry. So again, this is for new and current providers. We have gotten a lot of questions around the medication administration curriculum, and so more information about that training will be provided in the hopefully shortly in the next few weeks. For now, providers should continue using their existing medication administration training processes as required by the current regulations. This training program is also available in Spanish, which is wonderful. And so learners can have both the English and Spanish learning paths active simultaneously. So once the Spanish learning path is activated, learners will be able to access Spanish content and get their certification through the Spanish learning path. So just some fun facts. I think we shared these last time as well. And so since July 1 of 2025, the total number of learning path certificates granted is 31,356. So that's pretty impressive. That is a strong workforce. The total time spent learning was 147,346 hours. And interestingly enough, the most active day of the week was Tuesday. So in addition to some of the things that we have issued through the IHCP bulletins, one of them is we issued IHCP Bulletin 202606, which describes an established transition process from supervised group living settings to the CIH waiver. So this really established a standard process for individuals who wish to transition from SGL, also known as group home, into the community utilizing the CIH waiver. So this requirement is only applicable to current and future SGL residents who are applying for the CIH waiver and not to all CIH waiver applicants in general. So please keep that in mind. If you're applying for the CIH under the category of transitioning from a supervised group living setting, this process only is applicable to that criteria. So to facilitate this process, the following conditions have been established and are effective immediately. So the first is that the individual must reside in an SGL setting for a minimum of 365 consecutive calendar days. And that is before being eligible to apply for the CIH waiver. So that 365 days will start on their date of admission to the SGL setting or the group home setting. The 365 consecutive days in an SGL setting required before an individual is eligible may include up to 60 days of therapeutic leave within a given calendar year. So this is described in Administrative Code 405 IAC 5-13-6. And so if a person goes on their therapeutic leave, it will not count against the 365 days required for CIH waiver eligibility. But please keep in mind that therapeutic leave days that are more than 15 consecutive days and that are not pre-planned will require an IST or individualized support team meeting to determine the next steps. In addition, we've outlined that there may be some circumstances where an individual must be discharged, and that 365-day count will resume upon readmission. So the following scenarios would be allowable exceptions to the consecutive 365-day rule. So that would be one, that there was an arrest that led to time in jail. It could be a hospital admission lasting longer than the 15 days, and that hospital admission could be a medical or psychiatric admission, or an admission to a nursing facility. So again, this is all outlined in the Bulletin 202-606, and you can refer to that for more information. Another bulletin that we released on January 6th is Bulletin 202-602, which was regarding short-term budget requests. And so we wanted to provide you kind of a high-level information of what is provided in there, and make sure that ISTs are aware and adhere to the following. So the STBR, the short-term budget request, must demonstrate a current assessed need and be agreed to by the individual receiving services or their legal guardian or legal representative when applicable. Short-term budget requests are for a period of 6 months or less from the first date of the qualifying event started. Let me say that again. It's only available for a period of 6 months or less from the first date of the qualifying event. Prior to each STBR submission, the individualized support team or IST must ensure that the following things have occurred. So they must explore and document the active pursuit and implementation of other services and supports that are available. They must identify and document the first day of the qualifying event. They must develop a written plan demonstrating how support will continue during the temporary supports and after the temporary supports are no longer available or necessary, including the use of integrated supports. They must document or gather the documentation necessary to support the short-term budget request, and they must conduct the team meeting either via phone, virtual, or in person after the need for an STBR is identified. In addition, the IST must ensure that a qualifying event is appropriate. So additionally, each STBR submission must include all required and other relevant documentation, or it may be denied. The case manager must include an attestation form with the submission, and the Bureau of Disability Services, or BEADS, will only issue one request for information per STBR. If the requested information or clarification is not provided within the RFI response, the STBR may be denied. So it is really important to make sure that you provide all information and relevant documentation, including the attestation, so that if there is a request for more information, you're only going to get one of those, and you only have, the one response to make sure that all that information is submitted. Again, STBRs will not be approved for more than 6 months. If the individualized support team feels that the qualifying event will exceed 6 months, then a long-term budget request should be discussed and submitted, but only if appropriate. So please note that if an LTBR is submitted after 6 months of an STBR, it must align with one of the LTBR qualifying events. So, for example, loss of a housemate is not a qualifying event for an LTBR. So additionally, individualized support teams should be proactively working together to ensure the individual can be supported within their available resources And that's inclusive of natural or informal supports, community resources, and paid services and supports in alignment with the federal HCBS settings rule, which was established by the Centers for Medicaid and Medicare Services, CMS. In addition, only one STBR for the same time period may be submitted for an individual, regardless of the qualifying event. So qualifying events include the following. So it could be loss of housemate, it could be loss of employment, health and medical conditions have changed, behavior conditions have changed, loss of primary caregiver. There's a crisis situation such as abuse or neglect that has required state intervention. And if an STBR is denied, a subsequent STBR for the same time period may also be denied. So again, you can refer to that bulletin for more information, which is 202602. All right, so now we're going to jump into we have just a couple of trending questions. The first question is, who can I hire as a self-directed worker? So we are really excited about our new offerings as of January 1 of self-directed services. And so we're getting questions around who can be that self-directed employee. And so if you are an individual who is self-directing services, you can hire friends, family members, neighbors, or someone you recruit to be your employee, but they must be at least 18 years of age. They must pass a criminal background check, and they also must receive all required training related to the waiver and the services that they are performing. Just to keep in mind, individuals who cannot be paid to provide self-directed services include parents of minor children and spouses, also known as LRIs, or a self-directed representative, which would include legal guardians. So if a person is self-directing services, their paid caregiver may not be their parent, if they're a minor child, a spouse, or a self-directed representative, which include legal guardians. The next question we have received is around accreditation, and it states, if my agency obtains accreditation from an approved entity, even though it's not required, do I fall under the accreditation bucket? So the short answer is yes. If your agency obtains accreditation for one or more approved BEATS services through one of the entities that's listed in Indiana Code 12-11-1.1.11, then your agency would be considered accredited for the purpose of re-verification. So please keep that in mind, that you will need to ensure that you are providing the information necessary during re-verification around being an accredited service. So, for example, if your agency is approved for behavior support services and accreditation is obtained from one of the identified entities, then your agency would fall into the accreditation bucket. All right, well, that takes us to the slide that we provide every time that says, if you have any ideas or questions of what you would like us to include as webinar topic ideas, we would love to hear those. You can submit your topic ideas to BEADS Provider Services at fssa.in.gov. And so we really want to make sure that we maintain these webinars in a way that is beneficial to everyone. And so please don't hesitate to reach out with your suggestions or comments. And so we can ensure that these webinars are meaningful and provide you the information that you need. So I want to thank you for joining us today. Hopefully you are staying warm and safe, and I think it's going to be a cold one the rest of the week. And so we will plan to see you next month on February 24th at 3 p.m. Thanks so much and have a great day.